Hi, Dr. Dickenson here with St. John's Chiropractic Clinic, and I want to go over the information that you can expect the doctors to ask you about when you come in with a new complaint. The reason we want to get this out to you ahead of time is to allow you an opportunity to think about them before the visit, to allow for concise and clear answers to these questions, which is going to allow us to make the best decisions possible for your. Let's get right to it. New complaint information. Where is the complaint? Where are you feeling the discomfort? We'll have you map out the entire area you're feeling discomfort, and then we'd always like it if you could identify where you feel it's the worst. So of the area you're feeling pain, is there any areas that it's the worst right there? Do you have any symptoms down your arm or leg? Any radiant pain, numbness, tingling, anything like that down your arms or legs? That's really important information we're going to want to know. And then if you do have any of those symptoms down your arms or legs, we're going to be looking to ask further questions about that as well, about the intensity and frequency like we're going to go into here. When did your problem start? And what did you do to cause it? A lot of times we have patients, when we ask them what they did, they say, I'm not really sure what happened, or it gradually came on, I don't really know what happened. Well, if that's the case, I'd like you to think back to around the time it developed. What were you doing? Did anything change in your life? Did you get a new pillow, get a new chair, get a new car, pick up your hours at work? Did you move and pick up a lot of things like that? Anything out of the ordinary around the time of when your symptoms develop, that'd be good information to think about ahead of time. How intense is the discomfort out of 10? So we use a scale 1 to 10. 10 would be the worst pain imaginable, and 0 would be no pain. So you're going to fall somewhere in that range, and that's going to help us gauge your progress as we move forward. What does the discomfort feel like? Is it tight, sharp, achy? What's it feel like? How often do you have some discomfort with your complaint? So of your waking hours, what percentage of the time are you feeling some discomfort? What makes the complaint feel better or worse? And this is really valuable information. So what activities, positions, have you tried heat or ice, any medications, anything that's been helpful? And then conversely, what kinds of things that you do make it worse? Is the complaint getting better, worse, or staying the same? And then, do you have any other symptoms that you think are associated with your problem? We may or may not have screening questions for your complaint associated, but if I'm having this other weird symptom that I think is related, be sure to bring that up at your first visit too, okay? On follow-up visits, hopefully it's going to be an abbreviated version of that. We just want to know, is it better, worse, or the same since last time? We'd like to get an intensity score, so 1 through 10, how's it been feeling since last time? What percent of the time have you been feeling the symptoms since last time? And do you have any new symptoms or changes in the symptoms since last time? Also, it's a great time to get some feedback on the treatment. Was there anything that we did that you didn't like so much? Was there anything that you really liked, you thought was really helpful? And that's going to help us cater to make your visit as effective as possible for you. And then the home care compliance and questions. So we're almost always going to give you some ergonomic advice, postural critiques, exercises, things of that nature, maybe heat and ice recommendations. We're probably going to want to know how well you think you have been, following those instructions. And did you have any questions? Did anything come up? Were any of the exercises confusing, or you didn't know how to do them, or anything like that? We'd like to address those as well. Okay, so just want to get this information out here to help your visit be as clear, as concise, and efficient as we possibly can, and that should benefit everybody. So thanks a lot.